So for your vet wrap, you're going to pull it off a little bit because it does contract and it can get pretty tight. So you want to make sure it's not too tight. It clings to itself. You're going to go all the way up. Some dogs may require 2 rolls of that wrap, depending on the size and where you're going. And at the very end, you give them a little tread. They don't wear it down. A little tread. Up here, very important that you anchor this to the skin, to the fur, because it's going to slide off otherwise. So you have to put like probably around 2 rounds of elasticon around the splint. Make sure it's stuck to the splint and to the skin. This is really sticky stuff. This can cause a little dermatitis when it comes off, but it's better that than losing the splint and having to redo the whole thing. So the splint can stay on if there's no open wounds for about 2 weeks. After 2 weeks, you want to take it off. You want to make sure there's never any kind of weird smell coming from it. If there's a strange smell, if the dog gets a fever, stops eating, doesn't feel good, you want to take it off. Otherwise, leave it on for 2 weeks. If we have any abrasions, any oozing skin lesions, you can't leave it on for 2 weeks. You can leave it on for a few days. You put your telephone pad on with your antibiotic, put it on the lesion, and then maybe change it every 3 days.